The next talk is by Dr. Rajesh Rajani on the weight reducing drugs and role in the cardiovascular. Yesterday, I think where Rajiv Karnik was discussing about the GLP-1 in the preserved ejection fraction failure. I think one oral semaglutide is at least available. Monjurio and Ozempic, which was supposed to come in India this month, actually has been delayed by one more year because the overwhelming demand in the Western countries they could not supply in India. So the two injectable drugs which were supposed to come, I think they have made great difference in the cardiovascular outcomes. So Rajesh will talk about this thing.
Good morning, friends, and thank you all for your time and being over here. I thank from the bottom of my heart Dr. Palajani, sir, Dr. Sharma, sir, Dr. Gupta, Dr. Milind for making this a success. Thank you very much for your time. Let's do justice. My topic is weight-reducing drugs. Now, weight-reducing drugs have come over of late because of the impact that it's created on cardiovascular mortality. Not only that, but lots of other things which have happened when the person is obese. Now, weight-reducing drugs have to be only used when you fail in your lifestyle modification or dietary control. That is the most important thing because safety is a concern. So if there is no safety, then these drugs are completely out of the question. But there are drugs which are there, which are fairly safe, which have come into the market field. Now, the burden is 25% of world population, which is obese, 3% of the stroke risk, 21% of myocardial infarction, 51% of hypertension. So are there any super pills which are available over here? Lots of drugs have been approved by the FDA. Some of them have withered off because of increasing risk of cancer, because of increasing risk of severe side effects in the form of mental side effects, in the form of nausea, vomiting, in the form of diarrhea, lots of side effects there. And out of this, few drugs have emerged and floated up on the top, which probably creates a great effect. Now, we have these drugs, locazarine, semaglutide, which is Rybelsus, which is very, very popular. Then you have Contrave, which is a combination of two drugs, naltrexone, bupropion, phentermine, topiramate, setmelanotide, Orlistat, tongue-twisting names, but a lot of them have advantage, a lot of them have disadvantage, and finally few of them have reserved back. Two more new drugs which have come is tirzepatide and cagrilintide. These are the new drugs which have come into the forefront with a lot of phase 3, phase 4 trial. And I understand that tirzepatide is already available in the United States of America. Whenever we do the drugs, we'll see the landmark trials, mode of delivery, mechanism of action, and caution and side effects. Let's do justice to semaglutide. This is the most widely used drug. Let us see why. Semaglutide is significantly reduced the body weight by 15% as compared to 2.5% with a placebo over 68 weeks. It really causes an immense effect. Subcutaneous dose there, and the maximum is 2.4 milligram per. So there is a titrated dose for that. You evaluate the patient 4 to 6 weeks, and then go on slowly increasing the dose. It's a receptor agonist with increasing effects. It interferes with glucose homeostasis, food intake, and satiety. That means the ventromedial and the ventrolateral nucleus of the thalamus crosstalk with each other. It just snubs your appetite, basically. Cannot be given in patients who have got history of cancer, either in the families or they have, thyroid C-cell tumors, MEN2. It causes a lot of, not a lot, it causes a lot of GI effects, but most of them are tolerated. This is available in India right now. The most popular used drug, semaglutide. Orlistat, again, let's go one by one. We have Zendos, 2004 drug. It's Orlistat for lifestyle modification reduce a significant weight in around 40% of the patient and also reduce the HbA1c developing as compared to other lifestyles. It's given 3 times a day. It inhibits the activity of pancreatic and gastric lipases and decreases fat absorption. The entire 30% of the load of triglycerides is out of the body. So you reduce your triglycerides completely. You have to give multivitamins because it acts and reduces the vitamins in your body. It has a lot of interaction with vitamin A, D, E, K. When you use with warfarins or NOACs, there's a lot of interaction, so you have to be very careful. Not a very popular drug, but can be used in selected cases. Locazarine, banned drug now, you must know it. A big trial in 2010, reduced a lot of weight but it's banned because incredible, risk of cancer was there. So that's been banned. I've just used it so that we know. Setmelanotide, this is a drug which is used for kids right now, up to 6 years of age. It again is centrally acting for kids who have no mediation of the appetite. They keep on eating a lot of food and produce a lot of weight gain. And this drug is really, really beneficial for them. It will probably be extended for adults also. It's a centrally acting drug. It acts on the POMC, PCSK, all the deficiency state, genetic, Bardet-Biedl syndrome and Alström syndrome, which are associated with genetics. It's a subcutaneous injection, basically. And it's an MCO4 agonist. It acts in the paraventricular nucleus of the hypothalamus. So it's a centrally acting drug. Not much of side effects are there, just skin reactions and headache, nausea, abdominal. But currently used in kids up to 6 years of age. Cannot be used below that, 6 years and above, morbid obesity. Then you got phentermine and topiramate. These are two drugs used, involved in 2,400 and causes a huge amount of weight loss. Phentermine used in 8, 15, 30 and 35, topiramate 15, 25, 50. That's the dose schedule. We know that phentermine is a sympathomimetic that stimulates the norad and suppresses the appetite, and topiramate is an anti-epileptic drug. Side effects, it basically should not be used with central disorders, those who are on anti-epileptics. Withdrawal of topiramate increases the risk of seizures. Others like paresthesia, depression, anxiety. So a lot of memory problems. Not a very, very popular drug to use. Then you have, again, a combination Contrave, naltrexone and bupropion. Now, these drugs, a lot of trials there. It increases, weight loss, improvements in waist circumference, triglycerides, good HDL elevation. However, they are highlighted need for careful monitoring with blood pressure and heart rate. Combination is available in 8 milligram and 90 of bupropion, and it's a titrated dose. Naltrexone is an opiate antagonist which blocks opioid receptor-mediated POMC autoinhibition. So it's a centrally acting drug, and bupropion selectively inhibits the uptake of dopamine. So basically, you have to be careful with seizures, drug addiction, bulimia, anorexia nervosa, or in combination with opiates. Only used in selected cases. So coming back, are they safe? The answer is yes, with riders on. They are safe drugs. As I said, semaglutide, right now in India, is a great drug marketed under Rybelsus. It reduces the weight loss up to 15% over 68 weeks. And this level of efficacy surpasses that of many other available anti-obesity medication, making it an attractive option for both patients and healthcare providers. While all the medications come with potential, semaglutide has been tolerated well. As I mentioned, tirzepatide, again, a huge amount of trial of around 3,000 patients with severe weight loss. More probably will become more popular than semaglutide. And there's the other one which called cagrilintide, which also is subcutaneous. Both these drugs are subcutaneously monitored, and they are the new ones which are in the forefront. We have to understand the individual obesity phenotype and then give drugs, promote lifestyle modifications, educate the person for supportive environment, prescribe the drugs judiciously, and don't have a quick fix phenomenon. And clear understanding of potential side effects are very important. As I said, cancer, GI side effects, central side effects, they're not barred from that. That's probably the overview of all the drugs, and thank you very much for your attention.